m'appelle Salon encore une fois, on a dit bienvenue sur notre édition de Tête à Tête sur Télécréole. Nous parlons de l'émission ça en genre bilingue en fonction de l'invité que nous gagnons. Once again, we are pleased to welcome you on this new edition of Tête à Tête on Télécréole. Charles Lucien with you to present this program. We are pleased to start with guests that we had a chance to interview last year. They are part of the BU, Boston Medical Center, Global Neurology Department, and they've had their first trip in Haiti last year to collaborate with St. Luke Hospital and provide services in the neurology area. So for us to discuss how this project is going on, we are pleased to have with us Dr. Anna Holler.
Thank you very much for having us.
Bienvenue sur Télécréole.
Merci beaucoup, je suis enchantée de revenir.
Merci. We also have with us Dr. Malvika Sharma.
Thank you very much for having us on the show.
Thanks again. And we have with us also Marie Augusta. Welcome, Marie.
Thank you very much.
So let's go back a little bit. Again, last year we had a chance to interview your team as you were about to travel to Haiti. And my understanding is that in November of this year, 2014, you'll be going back. So the initiative picked up or is going on or going well.
Yes.
Can you tell us what's happening now?
Well, we were very excited last year to partner with St. Luke's Foundation in Haiti, and so we took a trip down to Haiti for a week where we worked in the pediatric hospital and also the adult hospital in Port-au-Prince. And while we were down there, we took care of patients in the hospital and then also in the outpatient clinics. And we really had a wonderful experience being able to help out with patients who had things like seizures and strokes, different types of brain infections. And we were able to help them with different types of medication regimens and exercises and things. And it made a big impact on us. And so we are happy to continue the mission this year.
Dr. Malvika, can you give us the background? What led to focusing in this particular area? There are neurological issues that were picked up either at the Boston Medical Center or it's based on data or information that you collected in Haiti that led the team to start collaborating with St. Luke Foundation.
So actually through our national organization, the American Academy of Neurology, we hooked up with a physician who's also a neurologist who's been going down there for about 10 years now. And he's been working at the St. Luke Foundation. So when we were collaborating with him to try and start a global health initiative, he kind of steered us in this direction and told us about the great need that they have down there.
Right. Mary, one question for you. Are these issues also found at the Boston Medical Center? I know that you work as a nurse over there. Are these issues frequently found and treated? Is it common among the Haitian patients?
Yes, we have seen a lot of Haitian patients at Boston Medical with neurologic problem, seizure, Parkinson, tremor, a lot of problem.
Right.
Stroke also is one of the big ones.
Now, as a matter of just educating our audience here, what are some of the causes? What may lead to maybe the most frequent neurological issues that you've observed at the hospital or in Haiti?
Yes, and so in the US and also in Haiti, we see the same type of things frequently. So the two big things are seizures and strokes, are the two big reasons why people end up in the hospital. And in the United States and in Haiti, there are often similar reasons for this. And so some of the reasons are things like brain infection. So if you have a brain infection, it can cause disturbance in the electrical activity. You can be more likely to have a seizure. For stroke, high blood pressure seemed to be a very common thing that we were seeing here in the United States and also in Haiti that was leading to strokes. Right. And so those are things that are potentially preventable. So infection, if we catch it early, then it might not spread to the brain. And high blood pressure, if we identify it early and treat it, might not contribute to stroke. So one of the things that we were working on last time was treating the emergency situations. But what we're hoping to do even more this time is work more on education as well to potentially also help with prevention.
That's helpful. I was going to actually dive into the prevention and education part because of certain things that I'm considering. Level of education of some of those patients. some beliefs that could be cultural in nature that may lead to certain interpretation of the symptoms. So what's your sense of
This is
these
a
issues?
very important issue. We're actually doing a study right now at Boston Medical Center under the direction of Dr. Georgia Montoris in the epilepsy, the seizure department, looking at people's ideas of why people have seizures. And she's looking at different populations, Hispanic population, et cetera, and the Haitian population as well, to see if they have any cultural beliefs about whether or not seizures might be caused by spiritual influences, etc. And so they're going to use that data to try and come up with educational maneuvers and different types of programming here in the United States. And I've been discussing this with Dr. Montours about whether that might be useful when we're in Haiti as well in terms of educational initiatives. So I think it is going to be very useful. And I think it also impacts the future of this program, where we really want to not just help right now, help prevent and educate for the future, but also dive deeply into some of the underlying ideas about why these diseases occur.
I did mention that will be some kind of doing this in a bilingual way. Marie, j'ai une question pour vous, que tu as commencé à discuter ça en anglais avec le docteur. Est-ce que nous avons observé parfois qu'il patient le problème neurologique ça ou gagne l'impression que vous parlez peut-être dans ces de croyances que vous gagnez, c'est de religion, même nouvel esprit qui vient sur vous. Je pense à monde comme si là qui connaît un cas de malcadie, qui
Yeah, c'est un bagay un problème yo, bien que longtemps j'ai travaillé en Haïti, nous avons un problème ça avec moun yo. Pile fois l'on dit on ça puis venir docteur dit oh non c'est un zombie envoyé dans tête li qui fait que la zombie en fait le kimel fait le trembler il fait laguer la terre donc il pas besoin de docteur qu'on aime cap mener l'on côté yo capable et ballon bombin yo courir et yo régler toute bagaille pour lui. Il y a des gens qui pensent que son problème spirituel. Donc, ils disent que c'est pasteur, puis ils joindre le comme ça. Donc, le comme ça, au lieu qu'il y ait le docteur, il y a le coup de pasteur, il fait pasteur prier. Qui est bon parce qu'il a besoin de prière. Il fait pasteur prier pour eux, il fait prier pour eux, et puis il va venir le docteur, puis il va venir plus détériorer. Même ici, tout, pendant que dans l'étude, ça, docteur, ou le sort fait allusion à lien, il y a des gens qui ont rempli le questionnaire en tout, ils ont mis que oui, et c'est un mauvais esprit qui fait que gagne. Le checker yes, que c'est ça au style pensé. Que bien que mon aux États-Unis, il y a combien de temps avec maladie, il voit que technologie, bah ça il still gagne même et croissance son problème lié.
Dr. Malvika, a couple of questions. Are there particular ways to approach this work based on if you are working on pediatric patients or with adult patients? Do you work with both groups, and what are some of the differences or factors?
Absolutely. So we actually worked with both groups when we were down there in the pediatric and the adult hospital. And kind of the differences that you encounter, especially with the pediatric patients down there, is that family is a very big part, and kind of that's where you direct most of your discussions and things like that with the children. But one of the great things that we noticed that was kind of a contrast to the United States was that family was always at the bedside, whether it was an adult patient or a pediatric patient, and they were always there, sitting there feeding the patient, helping them bathe, things like that. And it was just a very big contrast, and it was a great way to see how we could potentially give them the tools to rehabilitate from whatever kind of illnesses that we were treating them with.
Right. Now, when we say rehabilitation, I also understand that there might be need to have certain devices or equipments or supplies to keep some people who've been physically affected going. Do you have those kind of resources on the ground in Haiti?
So, you know, it's a very good question. In the facilities where we were working, there weren't as many resources as we have available in the United States. So even simple things like enough pillows, enough blood pressure cuffs and things like that. There really weren't enough of those, even basic supplies, gloves, cleaning solutions, things like that. And so what we're working on as part of our initiative this year is actually to help with the supply of the hospital in terms of those basic things, to try and improve the comfort of the patients, the ability to diagnose, and the ability to treat. In addition to that, there weren't a lot of resources for rehabilitation in the hospital itself. There was a rehabilitation program for some of the pediatric patients, but they weren't available in the hospital itself. And so what we're hoping to do is work some more on education for the families, because oftentimes they're the ones who are going to help with the rehabilitation.
Thanks. Again, we have with us Dr. Anna Holler, Dr. Malvika Sharma, and Marie Auguste, who's a nurse at the Boston Medical Center. We are talking about neurological work being done in Haiti. We are going for a short break, and then we'll come back with a special event that will take place this September 12th, and also with contact on how to be in touch with them. Back with our guest, Marie Auguste from the Boston Medical Center, Dr. Anna Holler, and Dr. Malvika Sharma from the BU and Boston Medical Center Neurology Department.
That's exactly right.
Now, I know for sure that it's not that there are tons of resources or funding to do this work, which means that some work has to be done to be able to get what you need and then to travel to Haiti. And I understand that this coming September 12th, there's a special event.
Yes.
Where professional staff, nurses, and doctors are going to be wild for some. It took place last year. Can you tell us what we are planning to help actually raise funds for this project?
Yes, well, thank you for bringing it up. So we have our annual talent show, our second annual talent show, and last year it helped us to raise money to help fund the trip and also to help fund the program and get it off the ground. And so the idea is we have members of the medical center, musicians and dancers and singers perform. We also invite the local community. So we have some wonderful patients from Haiti and who have a contact with Haiti, or just members of the community, the Haitian community, who are going to be coming and participating in this. And we really enjoy the collaboration. And we have the event itself. We also have food, and we have a raffle, and we have t-shirts for sale. And so we're hoping to get people to come down on September 12th, and it's at the Boston Medical Center in the Bax Auditorium. It starts at 6:30. It's going to be a wonderful event, and people can find out more online at our website, which is development.bmc.org/neurology global health, or they can just Google Global Health Neurology Boston Medical Center, and they'll get right to it.
Yes, we're also going to put the email contact for people to be able to address it. Marie, qui j'en pense moun yo accueilli programme dans projet dans l'hôpital là pour l'instant?
Dans l'hôpital.
Dans Boston Medical Center. Est-ce que il y a un Haïtien qui est au courant de projet avec qu'on travaille que pour nous faire pour nous mettre plus au courant?
Well, nous avons toujours continué de travailler, plus travail pour plus mon au courant, mais nous envoyons pile email à différents départements. Donc, nous essayons de contacter mon YouTube par téléphone. Nous avons des tickets que nous avons, nous avons des t-shirts que nous avons. Donc, nous mettons tout le gens visible pour nous connaître. Et puis, nous faisons connaître que des locaux artistes qui viennent, qui jouent et qui jouent. Zama, Rebecca Zama. We have Dina Jerome. She is a very good gospel singer. And we have some people from the Berkeley School. They will perform. So we have a very nice program.
We Not
this year, not this time. So we got a very nice program, and we try to reach out to people. And I was at a meeting with HAU, and some of the members bought tickets, so they're planning on attending, on coming to this.
I know of 2 more people who will be coming.
Yay!
I have a question for you, and, as I mentioned before. L'adaptation, la capacité de collaborer avec staff en Haïti. Je sais que vous parlez français, mais pour les autres membres de l'équipe qui ne parlent pas français, comment l'intégration se fait entre l'équipe de Boston Medical Center et l'équipe de Saint-Luc Foundation?
Et c'est très important de pouvoir communiquer, puisque si on ne peut pas communiquer, on ne peut pas faire de l'éducation sur les sujets neurologiques. Alors, on était très contents de pouvoir avoir Marie avec nous. Elle a fait beaucoup de travail pour parler avec les infirmières, avec les docteurs et aussi avec les patients pour pouvoir leur discuter. Et aussi beaucoup de médecins en Haïti parlent français, alors moi j'ai parlé avec eux aussi, et il y en a aussi des gens qui parlent anglais en Haïti, alors on a utilisé les 3 langues pour pouvoir communiquer, et on espère à Boston Medical Center, notre équipe, à apprendre le créole aussi. Alors je pense que ça sera encore plus pour nous, ça va, nous allons pouvoir communiquer encore plus comme ça.
Oui. Est-ce que vous avez eu l'impression qu'en Haïti, il y a une conscience très élevée des problèmes neurologiques en cours? Est-ce que l'État, par exemple, vous avez une collaboration de loin ou bien de près avec l'État haïtien pour ce projet?
Oui, alors je pense qu'on a commencé avec l'hôpital et la Fondation Saint-Luc, mais on a beaucoup d'espoir de pouvoir agrandir ce mouvement neurologique en Haïti, puisqu'il n'y a pas beaucoup de neurologues en Haïti. On nous a dit qu'il n'y a que 2 pendant tout Haïti. Alors, il y a sûrement beaucoup d'éducation pour les médecins et aussi pour les patients en Haïti. Et on veut communiquer plus et avoir peut-être des conférences neurologiques en Haïti pour pouvoir augmenter l'information pour les gens.
Merci. Dr. Malvika, in my opinion, the data doesn't always tell the whole story. Are there particular episodes or success stories that you've seen, witnessed in Haiti that may tell people or speak to people in a way that they understand exactly what it is, less than about the data and the concepts, but real stories that have been successful?
Absolutely. So, you know, we were fortunate to see quite a few patients while we were down there. But one that really stuck out to me was a young gentleman who, you know, was in school studying. And a year prior to when he came to see us, he had a motor vehicle accident where he had a pretty bad head injury, but he recovered from it great. And he was presenting to us at this time after having 2 seizures. So kind of, you know, coming out of nowhere, he wasn't really sure what was going on. It was really impacting his life. So, you know, we had the ability to take images of his brain, and, you know, we saw some areas that maybe could have been the cause of the seizures. So we were able to give him medications, get the seizures to stop, and with our collaboration with other neurologists that are going down there, we were able to further identify a few months later that, you know, he was doing okay, the medications were working, and the things that we saw in his imaging were actually not life-threatening to him. So we actually were able to impact his life, and he was doing much better, and he was back in school.
Wonderful. Now, when you travel in Haiti, yes, you know, you need those funds that you raise, but beside the expertise on those funds, are there other things that you also have to literally or physically bring in Haiti?
In terms of supplies and things like that? Okay, so oftentimes, actually, it's not easy to bring things from the U.S. down there. But what we have done is we've been working with Marie on some collaborations locally to go with the funds and purchase the supplies in Haiti, which we think has a double benefit. Number one, the supplies are local, and so it helps the local economy. And then number 2, then it's easier in terms of transportation. We're able then to increase the amount of supplies we're able to provide because we don't have to transport them. So we're very excited about this collaboration that can increase the amount of availability of resources for the local Haitian community.
Marie, I was wondering if beside the Saint-Luc Foundation, there are other institutions that collaborate with this project. I'm thinking, for example, of Healing Hands for Haiti, that is with Elisha Zamor at the helm.
Yes. Well, we can work with them, but we received some, when people heard that we were coming, and there is a Université Lumière, I think you know that university, Jean-François Chéry is, I think he's a dean or one of the professor down there, and he would like for the global neurology team to come and give a lecture to the student down there. And also we received an invitation to go to one of those places in Kenskoff. I think they have a clinic down there. So we start with St. Luke, but other people heard that, you know, neurologists, specialty people are coming, so they want us to provide some, to see their patient and give them some advice. And
I think it's a wonderful idea because ultimately, once people start getting exposed to this type of knowledge and expertise, they get interested, and I can see some of those future students deciding to actually focus their area of expertise into neurology as well. So as we are about to end here, I would like us to again share the specific information about that location, both in English and in Creole.
Okay, all right. Well, we'll let Malvika do it in English.
Sure. So please join us for our second annual talent show that will be held this Friday, September 12th, starting at 6:30 p.m. at the Baxt Auditorium located at the Boston University Medical Center.
Thanks. I forgot one question.
Yes.
And the Saint Luc Hospital again is based in the Tabar area, not too far from Port-au-Prince. And the patients that come from all over the place? Or?
Yes, so predominantly there are patients from the Port-au-Prince area, but there are patients who are, if they're able to get transportation, might come from further away to be able to get the neurological services.
Right. And I'm sorry again, this is coming back right now to me. Do you get referrals from some major hospitals, either State Hospital or even the Mir-Balais Hospital?
So we actually haven't necessarily put the word out to those institutions that we're in the area. So usually what happens is the St. Luke's patients are alerted that we're going to be in town, the neurological patients that they follow. So we see all of those patients, and they can be seen up to every month because there's usually some neurologist visiting. We come once a year, but there are other neurologists who go. And then what we have hopes to do is to collaborate with other institutions, but we haven't necessarily gotten to that point yet. We need more funds for that too.
I bet.
Yes.
Eh bien, Marie, si vous avez une dernière information encore, pour rappeler mon qui côté va faire à qui là?
Oui, c'est vendredi 12 septembre à 6h30 dans Bass Auditorium, Boston Medical, que nous avons fundraising ça. Nous avons tout le monde venir. Donc, nous avons un bon moment parce que nous avons mangé, nous avons divertissement. Donc, nous avons nous toutes là.
Merci, Malvika, you got this one. Thank you very much again, Dr. Malvika Sharma, Dr. Anna Holler, and Marie Augusta. Two reminders again, this is going to be on September 12th at 6:30 p.m. at the Bask Auditorium at the Boston Medical Center. And then people can access it, no fee to get there.
Well, there is a little ticket charge that's a donation.
Donation, right.
Yes, a donation we would request, yes.
Wonderful. Encore une fois, nous rappelons Mounio et c'est pour 6h30 dans le Basque Auditorium dans 12 septembre à Capéville, en parlant de vendredi et surprise, ma plat. Happy there.